They're lying to us, ladies and gentlemen. All lies.
Oh? Okay then. I guess you're gonna spend some time explaining that, right? Well, anyways, this is the Officer Tatum, and he's going to let us know exactly how the coronavirus is a lie, I guess. Well, this is going to be an interesting one. I guess that coronavirus conspiracy theories are never ending. But if you're new here, go ahead and hit the subscribe button, hit the bell notification icon, and then maybe you'll be able to see episodes whenever they come out. That all really depends on if YouTube's algorithm is actually working that day, or if it's got to tie its shoelace, I guess. In the meantime, y'all know the drill, fan art, then video. So, first we have a fan art of a dad Suris, a la the stream I did with Jake from Hannah and Jake. That one is from Jack and Quill. We have the Bread is on Fire from Olivia Anomaly. And finally, we have a Nekomani Suris with a bread cat. That one is from Ghost Chan, and I honestly think bread has now officially infected all of my streams. Alright, let's go ahead and get into the video.
Let's get into this. So, ladies and gentlemen, I need to vent real quick. I just want to vent. It ain't gonna cost you nothing.
Well, it's likely gonna cost me my time, but I'm all ears. What you got?
I just want to vent about these masks. Now, I hope that you two don't get mad at me, but I need to tell the truth about these masks. In the state of Arizona, they all of a sudden want you to put a mask on or what? They don't work!
What, you mean the masks that we wear to prevent the spread of coronavirus right now? The masks that other nations actually wear all the time in case they have a cold and stuff, and it actually prevents the spread of the common cold pretty well. Those masks, right? Those ones?
What is a mask gonna do for you? Ladies and gentlemen, riddle me this. If you can smell a fart through that mask, you getting COVID.
Ah, I see. You think that COVID is transferred through gas, and that's the problem here. Okay, so, alright, so in the earlier stages of the coronavirus pandemic, we did have some issues trying to figure out how exactly it spread, but we have a pretty good idea now. You see, while the coronavirus itself is incredibly small, the virus cannot transfer anywhere. It has to actually adhere to a liquid droplet. These liquid droplets are sprayed out whenever you sneeze or cough. This means that if the liquid droplets happen to, you know, slam on the side of your mask, the likelihood of you actually breathing in the virus is now a little bit lower because you're not breathing in the liquid itself. And also, if the person who has the coronavirus is coughing or sneezing into their mask, that all gets caught by the mask. It doesn't pop out. If you think that COVID carries itself by gas, then sure, but that's not how it spreads. It spreads itself through those liquid droplets. So actually, masks do in fact work, and they've been working in other developed nations just fine.
You finna inhale it all in your nostrils. They going all the way down in your lungs. It's no way that little stupid mask is gonna stop you from doing anything.
Okay, but are you going to actually explain why that is? Are you going to explain the actual transference method of COVID? Because I did that, and I would hope that you're going to do the same if you're going to be presenting to us, the viewers, a video about why masks don't work.
Why are we doing it? In the words of my friend Damani, a slave muzzle. That's what it is, a slave muzzle.
Okay, so everyone who wore a mask in Japan to prevent spreading the common cold well before the coronavirus, they wore slave muzzles then, I guess? That's where you're going with this?
To see how far you're gonna go and how much you're gonna listen to some crazy government conspiracy theory.
Oh, there is certainly a crazy government conspiracy theory going on right now, but you may be surprised as to whose mouth it's actually exuding from.
It's eating away at me. The foolery that's going on. Just read an article that said that San Francisco is shutting down indefinitely because the numbers are rising. Let me tell you the truth about the numbers. Ladies and gentlemen and ladies, what do you think? You're never gonna get it? You think you can stay in your house until it just dissipates? It's not gonna happen. Now the numbers rising. Use your common sense. When you open up the country, after everybody's been locked down, do you not think people are gonna get the virus?
That's not the issue at hand. It's not that people think that they're going to be able to sit back and it will magically go away. But like with other viruses that we've dealt with, things like the Spanish flu, there was a period of time where certain areas were considered hot zones, and while those areas were hot zones, going outside presented a much higher risk. Moreover, even if the risk wasn't just to yourself, if you happen to be taking care of an elderly person or someone with an autoimmune disease, then while you might have no problem with the virus when you catch it, they probably will have immense problems once they catch it. But again, the issue isn't that people think that it's going to just magically go away and then they'll be able to carry on with their lives again. This isn't what happened with Spanish flu. It's that the likelihood of you catching it decreases when there are fewer people around who have it. That's basic math. I hope you understand that, since apparently you don't understand the math behind why a mask works.
What sense does that make? We expected the numbers to rise. The real question is, are people dying more? And the answer is no. Do they have an accurate number on the mortality rate? No. You know why they don't have an accurate number? Because they don't know how many people have it.
Right, which means if we don't know how many people have it, and we have deaths rising regardless, then likely we have more deaths from COVID than we think, because we aren't able to test everybody who dies. We don't currently have enough tests, and Trump, the guy that you're supporting there on your hat and your shirt, that guy has also been trying to remove tests from people so as to better positively affect his numbers, and he's not really made any bones about this. He's been perfectly honest about it. He said as much when he said that if we tested less, the numbers would look better.
They don't know how many people had it. They don't know how many people are asymptomatic. But they're sitting there telling you you should be worried and running around like a chicken with your head cut off.
They didn't say be worried and run around like a chicken with your head cut off. They said be informed and be careful. Those are two different things. You're the one assuming everybody's going to run around like a chicken with their head cut off. In the early stages of the pandemic, yes, people freaked the hell out. We didn't have toilet paper for weeks. We literally had to either use wet paper towels or borrowed toilet paper from other households, simply because it just wasn't available. As people adjust to living in a new norm where a virus is present, the running around like a chicken with their head cut off, that kind of ceases.
May we continue. They're not even testing properly. They're not testing properly. Ladies and gentlemen, they can say you have it even though you haven't been tested for it. They can say you had it post-mortem if you had any symptoms associated with it. What are the symptoms, Brandon? Everything you can think about is a symptom if you're sick from anything.
Right, so I'm gonna go ahead and say a couple things here. One, earlier in your video, I exited this part out because I don't feel like becoming free advertisement for you. You mentioned that you were opening up a new news site that had 100% verified facts all the time, and now you're saying this. Let's go ahead and look that up. So after looking at the reports from several news organizations and from the CDC, as well as other sources, all of which will be provided in the description below, I found that it's been stated that there isn't any pressure on people as certifiers for COVID-19 deaths or colleagues that they've talked to. There isn't any pressure to over-report how many people have died to make a crisis look worse, or even to under-report it to mitigate whatever agenda that might favor. This was a quote from Dr. Thomas Gilson, who is a medical examiner who reported on all of this in April. He specifically pointed out that they're not hiding deaths. They're not over-reporting deaths either. The CDC have given guidance on what constitutes a coronavirus death. These guidelines were given to all healthcare practitioners and were definitely given to Gilson in Ohio. Thomas Gilson said that these guidelines were good, reasonable, and fair, and they're a good way to track the extent of the epidemic on mortality. He goes on to state that there are a few reasons for the ambiguity around this reporting. The first is that while some who contract COVID-19 die as a direct result of the disease, others have conditions and their death is considered associated with COVID-19. There's people who die very obviously from coronavirus. It's a respiratory infection, and if someone has pneumonia and they're COVID-19 positive, there's a very obvious death related to the coronavirus. And yeah, I'd have to agree, if you have two respiratory illnesses side by side, then one of them is certainly going to make the other one much more complicated and kill you. It's like when somebody says that you didn't die from AIDS, you died from the cold, even though AIDS like literally made it to where the cold could kill you, or how somebody dies from blood loss because they're on blood thinners because they have diabetes. You died because of a complication of having diabetes. Gilson goes on to say that if someone has something like COPD, which is chronic obstructive pulmonary disease, someone like this already has a compromised respiratory function, and this is something that coronavirus directly attacks. This constitutes an associated death. If COVID-19 actually played a role in your death, the condition will be specified on the death certificate. This is not some conspiracy theory, this is a thing we have done with diseases since the dawn of, well, modern medicine. When we find that there are certain diseases and certain complications that lead to someone's death, we mark that shit down. So let's go ahead and look at the CDC guidelines themselves to see what these are all about. And as it turns out, there's actually a handy-dandy video on this provided by the CDC themselves. This provision is given in a document that I will be linking in the description below, but let's go ahead and look at that video and see if any of it matches up with the conspiracy theories that Brandon is trying to convince us of.
In a public health emergency such as COVID-19, death certificate information is critical in measuring the pandemic's effects on the population and directing the appropriate public health response. Death certificates provide crucial data on causes of death and are used to document deaths resulting from this pandemic. This can only be done with complete and accurate cause of death reporting. When COVID-19 is determined to be the cause of death, it is important that it be reported on the death certificate. Otherwise, proper tracking of the pandemic is not possible. Proper cause of death certification requires that you use your best clinical judgment to determine the causes of death to report in the cause of death section of the death certificate. Report the immediate cause on line A. This condition should be followed by any relevant intermediate causes in a logical sequence in terms of time and etiology below. A specific underlying cause should go on the lowest line used in Part 1. Leave any unused lines blank. Any other conditions that may have contributed but were not part of the sequence in Part 1 should be reported in Part 2. If COVID-19 is determined to be the underlying cause, it should be reported on the lowest line used in Part 1 with any conditions to which it gave rise, such as pneumonia or respiratory distress, in a logical sequence on the lines above. Comorbidities that contributed to death, such as COPD or hypertension, should go in Part 2. A 34-year-old female went to her primary care physician complaining of 6 days of fever and cough. She was admitted and underwent a CAT scan of the chest, which revealed diffuse ground glass opacification, indicative of viral pneumonia. PCR testing of respiratory specimens confirmed COVID-19. Her condition worsened over the next 2 days, and she developed ARDS. She was transferred to the ICU and started on positive pressure ventilation, but expired on hospital day 4. The immediate cause was acute respiratory distress syndrome, so that should be on line A as a consequence of pneumonia, which should go on line B. The underlying cause was COVID-19, so it should be reported on line C, the lowest line used in Part 1. Remember, if COVID-19 is determined to be a cause of death, it should be reported on the death certificate. Report an underlying cause that is specific, along with a logical sequence of conditions to which it gave rise in Part 1 and comorbidities in Part 2. By reporting a specific underlying cause with a logical sequence, you will be doing your part in ensuring the quality of cause of death information, which is needed to understand and fight this pandemic. For more information, training, and guidance on the COVID-19 pandemic and cause of death certification, see the links in the description below.
So that was straight from the CDC. That listed exactly the way in which they do their reporting. This means that if COVID-19 contributed to your death, then it would be written down in a hierarchical fashion based on how influential it was on the death. There's nothing that's really unintuitive about that. That's not even terribly complicated, so I don't understand why people constantly get this wrong. Then again, I guess it makes sense considering people still get things wrong about how masks work. But let's go back to Brandon.
Headaches, dehydration, fatigue, losing taste and smell. Diarrhea. You could go down a list. That's almost a fever. You go down chills, body aches. You can go down the list. Some of those symptoms are STD symptoms. Okay, but y'all don't want to keep it real.
Yeah, no, people actually don't have a problem keeping it real. The issue is that you're thinking that doctors are trying to work under this conspiracy theory that they have to over-report in order to make certain that some agenda of making people wear masks so that they are complacent to be slaves is eventually reached. What is more likely? That a handful of cases are reported over and above simply as a desperate attempt to try to get the most accurate results possible. Again, I provided the exact method that they use for putting these deaths down. Applying Occam's razor, what is more likely, or explains the situation better? A handful of overreported deaths because of the methods being used right now, or a conspiracy because of a backwards cabal in the government that is desperately trying to get everybody to wear masks because they're poking and prodding society like it's some type of experiment in an attempt to see how many people they can enslave. Which one of these two is more likely? I'll let you hang on that one for a minute, I guess.
But look at what they're projecting on us. Lying, deceiving you, having you doing this, having you doing that. You go into restaurants in 2020. Look, in 20 years from now, we're going to look back and realize how stupid we've been.
Right. Well, you know that 100 years ago, we actually did all of this for Spanish flu, right? Like, we did a lot of the lockdowns, we did the masks, we did, like, all of this happened 100 years ago. And we don't look back on that and go, wow, we were so stupid. We actually look back on the naysayers who said that none of these things would work and call them the stupid ones.
You go in a restaurant, they want you to wear a slave muzzle. You go in there with the thing on, and then when you sit down, you take it off.
Right, because once you sit down at a booth, the likelihood of you coming in contact with the other patrons significantly decreases, whereas once you get up out of the booth, the likelihood of you interacting with the other patrons increases. And it's when you're interacting with the other patrons that the mask is important. I've literally gone into restaurants with my mask. I've seen this all happen perfectly normally and fine. I don't understand why this is so hard for you to get.
So what's the point of wearing it at all?
Well, when you make this mistake of thinking in things like they're binaries, you tend to run into this problem all the time. If the masks aren't 100% effective, then what's the point of them at all? That's the logic that you're using. But you're refusing to look at these things in the realm of reality, where this is about prevention, not absolute destruction of the virus. We do not have the method yet to absolutely destroy the virus. To break it down, if you and somebody are interacting and neither of you are wearing a mask and one person has COVID and they cough on you, the chances of you getting COVID are somewhere between 90 and 100%. Those chances go down by about 30% if you're wearing a mask, because now the area where you breathe is no longer a risk zone. Yes, you could potentially touch some part of your face and then wipe it into your eyes, and then it gets through the tear ducts, which is another liquid area, which is where COVID wants to be. But again, the number of areas where the virus can get in has been reduced. Now, let's say that the person who has COVID-19 is wearing a mask. When they cough, all those droplets are going to be caught by the mask, and the barest of smallest amounts may escape because they aren't wearing it correctly or something like that. The chance of getting the virus now has decreased immensely, especially if you're already wearing a mask, since there's a 2-week incubation period where you can transfer the virus, but you don't have any symptoms of the virus yet. So wearing your mask as the default when you're out is generally a better practice than just not wearing a mask. Note, none of these things are 100% effective, and if you're looking for a 100% effective method, there is none. Just like how even abstinence-only education does not actually give a 100% effective method of avoiding STIs and STDs, because you can still get them from other ways, wearing a mask is not 100% effective. I can go back to the sexual conversation as well, point out that the apologetics you're using against masks effectively work against condoms as well. If condoms are only 99% effective, then why wear a condom anyway? You might as well go ahead and raw dog it. Except that logic sounds silly when we apply it to anything else besides masks. That's because it sounds just as silly when you apply it to masks, Brandon.
You sit down and take it off. And people got to understand this. The slave muzzle, aka the mask, isn't to stop you from getting it. Supposedly, it's to stop the molecules from getting on surfaces or getting on somebody's face or whatever the case may be. But there's no standardized mask.
There doesn't have to be a standardized mask. Literally any piece of cloth that is thick enough to absorb liquid is going to be sufficient for our purposes here. You don't need a standardized mask to absorb liquid. This is like saying that a towel cannot accurately absorb liquid. We shouldn't use a towel because there is no standardized towel. Like, if I have a spare shirt, I shouldn't use that to wipe up soda that's about to go to my PC because my shirt just so happens to not be a standardized towel meant specifically for this job. It doesn't have to be. It just has to be something that can do the job well enough. I guess people shouldn't have been using hammers for years before we had a standardized hammer. Like, you don't have to have a standardized tool to handle a rough shot job. Or maybe that's just the logic of somebody who grew up in the South and repaired half his shit with duct tape.
N95, you could wear a sheet on your face. You could put a pillowcase on your face. Not making a connection with the Klan, but you could put a pillowcase on your face and it's considered a mask. I mean, you can put stockings on your face. Oh, like, no standardization.
Yeah, and there doesn't have to be one. Most everything you listed there is at least thick enough to absorb standard liquids, which is the transference method of the virus, which is how you prevent it.
But they want you to believe it. They want you to fall for it. They want you to be a zombie.
Yeah, Brandon, I think you'll find that the zombies are actually the ones parroting your nonsense. I don't see any sources in your description or anything backing up your claims. I just see, like, a bunch of intuition, whereas I'm willing to actually pull the actual documents from the CDC. One of these things, one of these methods, is not like the other.
It's killing me, ladies and gentlemen. Let me get to the real point of why I'm even saying all of this as I rant. They are using this, and I'm not saying people ain't passed away from this thing. All I'm saying is that they lying to you about how many, they lying to you about how effective it is. It seems to me that it's just as bad as the flu, and it's just as bad, I mean, pneumonia is probably worse.
Right, so let's go ahead and pull up the Johns Hopkins Medicine article on the comparisons between COVID-19 and the flu. While in symptoms, transference, and many other areas, these two things are quite identical, there is a fundamental area in which they differ, and that is in the complications section. COVID-19 has lasting damage to the lungs, heart, kidneys, and brain, and other organs, and given that many of these are long-lasting and long-term effects, we don't actually know the full extent to any of these yet. That's not a point in your favor, that's actually more of a scary point. Influenza can cause complications, including inflammation of the heart and multi-organ failure, but those are not long-lasting. Influenza generally does not have any of the long-lasting effects that we are seeing crop up with COVID-19. This doesn't make it better or worse, they both can kill you. Hell, I almost died from the flu. It was back when I used to be working as a standard worker at Quick Trip. I caught the flu at the same time as a family member. I went to the hospital one day before they did. We caught it at the same time. We were about the same age. They died and I didn't. The only thing that saved me was going to the hospital one day earlier. I decided not to try to tough it out. Turns out, treating diseases with the respect they deserve actually saves your life. Who would have figured? Also, in the comparison sections, COVID-19 has about double the mortality rate of the flu. It's likely more than that. There have been approximately 590,608 deaths as of July 17th, 2020 related to COVID-19. That's across the world, by the way. That's not just the United States, so you can't do your whole, oh boy, they're trying to enslave us with masks thing. No, this is a worldwide figure. Whereas the flu, given an entire year, as opposed to the 7 months we've had with COVID-19, kills 290,000 to 650,000 people per year. This means COVID-19 has at least twice the mortality rate of the flu. So when you try to say that it's just as bad as something like this, that doesn't really work. As always, I will be providing the link to that source in the description below because I'd like you guys to be able to read and fact check me. That's kind of important to me.
And I know I've had the COVID. I haven't been tested, but I know I had every symptom they said I had. I had it. I stayed away from everybody, and then I came back to life. Now, listen to this. They really want to use this as a leverage point in a political manner. That's why they're doing it. Why are you shutting down your state indefinitely? Because they're trying to push it all the way to 2020 in November.
Oh boy. So the fact that circumstantially a virus was discovered in China in 2019, a virus that has affected the United States more than most other countries because the United States has such a piss-poor response to it, this is now suddenly a political thing? the pandemic, the pandemic that is killing real people right now outside in the real world, and that you think that you've gotten, and I know I've got 2 friends that have caught it and 3 family members that currently have it. This is a political conspiracy. That's what it is. It's got to be a political conspiracy, or it's got to be a method to indoctrinate you into slavery because you're wearing a muzzle, despite the fact that people aren't slaves in other countries where they wear masks regularly. Like, it's got to be all these things. It has to be all these conspiracy theories. It can't just be that we have a virus that is being poorly managed. We've had poorly managed viruses before. Just look at the AIDS epidemic. That was something that we had a lot more control over than we allowed ourselves to do. And yet, we had a piss-poor response to it. We're having a piss-poor response to this right now. About the only thing political about this is the fact that the infection rate is higher in states that have not done mask mandates, and that Donald Trump's response to the actual virus itself has been absolutely abysmal across the board. But to argue that people are trying to use this as a leverage point in a political agenda is really weird. The only leverage point that you can actually pull out of COVID-19 is the absolutely real fact that Donald Trump has not been doing a good job at handling the pandemic. That makes it automatically his fault. That's his doing. The guy who you support with your shirt and your hat and your dumb attitude, all of that, that's his fault. He did that to himself. He had every ability to respond to this virus with maturity and with actual power, and then he decided that that power was better to be used to gas protesters instead of actually handling a pandemic like a functioning adult. I'm sorry, Brandon. You want to try to convince your audience that you're going to have a news section thing at some point that's going to give accurate news to everybody, and they're going to be able to believe it 100% because you verified everything. But the display you're showing right here shows me that not one person should probably be looking to you for accurate news.
I mean, if you ain't to that point right now, I don't know what's wrong. It started out as 2 weeks. Remember? 2 weeks. We got 2 weeks to slow the curve. It's been 5 months. I don't know. I think it's been about 5. Let me see. February, March, April, May, June, July. It's been almost 5 months. 5 months since they've been actively trying to combat this thing. How has it gotten this far? And then, wait a minute. They ain't even talking about the next wave in the winter season in November. They're not even talking about that. So they're gonna shut it down again. They don't want you going to the polls. They want the economy to die so the president will not get reelected. That's what it's all about, ladies and gentlemen. That's what it's all about. If you don't believe it at this point, I don't know what you smoking.
All right, let's go ahead and roll with your batshit stupid conspiracy theory for half a second here. You do realize that if nobody goes to the polls, right? If nobody goes to the polls, then Democrats can't get voted for either, right? You're aware of that, right? That basic, bog standard, bottom of the barrel intuitive response did not occur to you. That in all of this, if Trump cannot be voted for, neither can Biden. Neither can whatever fucking dumbass libertarian person you think should get it. None of those people can be voted for if the polls are closed down. That doesn't mean Trump automatically doesn't have his presidency. If an election season can't happen, then Trump is going to have to figure out some other way to get somebody else reelected, else he would just end up being defaulted. But in any case, there is an option that people have had this whole time, and it's called the mail-in ballot. It's how people have been voting when they can't make it to the polls for years. But oh, wait a minute, hold on. Your president is the person who's been trying to stop mail-in ballots from being a valid option to actually tally your vote. And his apologetics are things like, oh, people are going to unaccurately do mail-in ballots. They're gonna have mass fraud, even though it's never happened in any year specifically to mail-in ballots. We have mass fraud when it comes to the electronic ballots we use right now all the time. Even ignoring the fact that all the same mechanisms would be used for verification of individual people that we use when calculating people's taxes, and those can be done via mail as well. Like, all of this base shit, this isn't even using logic. This isn't deductive logic. This is literally just base intuition. Just taking a look at the situation and going, oh, let's look at the stuff on the table. Your president is trying to stop the ballot that would allow him to be re-elected in the election season, even if everything had to be on lockdown. Moreover, other countries have not had to shut down their economies completely in order to continue functioning in the pandemic because their response to the pandemic was infinitely more holistic and useful than the one we used in the United States. And all of that, again, falls on your favorite president. I don't know how we got to this state in reality where everything has to be a conspiracy theory against Donald Trump. Everything. It is all conspiracy theory against Donald Trump. Police brutality. That must be a conspiracy theory against Donald Trump to say that he's an authoritarian fascist, regardless of all the facts that say that he is. COVID-19 must be a conspiracy theory against Donald Trump in order to make him not get reelected next year. Oh, I want to say that I don't understand this mentality, but I do. I've had this mentality before. This is the mentality I had when I was in my last year of high school and I was shown the movie Zeitgeist for the very first time. When I was introduced to the first time to things like the loose change theory about 9/11, to things like Alex Jones, when I was first introduced to these concepts, I grasped onto anything that seemed like it was connected to the Illuminati, that seemed like it was connected to the Bilderbergers, the elites controlling the world. After a while, I realized that, yeah, rich people controlling the world is a thing, but all of the things like globalists and other stuff that we use to describe them, that's all dog whistles. It basically just ends up meaning shit like Jews. I was biting into an anti-Semitic conspiracy theory that said that no matter what happened in the world, it was bad. It had to have been the Jews that did it. The Jews were behind it, George Soros was behind it, something like that was behind it. That is an old as shit conspiracy theory. It's literally the conspiracy theory that allowed Nazi Germany to execute so much of its Jewish population. So I want to say the thing that comes to my chest immediately, which is, I don't understand how you got to this point, but I do. I get it. I've been here. I've been you. Everything was Bilderberg, everything was globalists, everything was the elites trying to do one thing or another. There are some things that I learned during that age of my life that did get confirmed and were in fact important. Things like the sinking of the USS Maine being used as a provocation for conflict, things like Project MKUltra being used on our own American citizens. Like, yeah, there are real things that the United States has really done to its citizens that has really screwed up. But the idea that everything was that is a conspiracy theory. That's the nonsense part. It's not everything. I've been there. I've been you, Brandon. I've been that person. Everything for you right now has to be a conspiracy theory against Donald Trump. At least these things are. I want so badly to say I don't understand this and to just point the finger and laugh, but I've been here. I've been in these shoes. I know what this looks like. I know what this feels like. You're living in a world where you have to have an enemy, and that enemy has to be against your favorite person. This was the mentality I had when I was a huge Nintendo Wii fanboy, and every single exclusive game that came out for the Xbox 360 and the PS3 was some kind of conspiracy from people who hated Nintendo, who didn't want Nintendo to have good games. Even when some of those games got ported to the Wii, and it was shown to me very clearly that Wii just wasn't powerful enough for half these things. When you accept this narrative that everything has to be against you, everything has to be connected in some way, you start connecting dots where they don't exist. I'm sorry, Brandon, there isn't a conspiracy theory against Donald Trump in regards to COVID-19. Any type of way that people feel that they need to vote in regards to what's going on with COVID is something that Trump brought on himself because of the way that he himself comported everything he did in regards to the virus. Our response, in hindsight, should have included things like mask mandates. It should have included things like social distancing. But we, as Americans, are so individualistic that the idea of sacrificing even a modicum of our perception of freedom is enough to make people second-guess things like wearing a piece of cloth on your face. Wearing a piece of cloth on your face to protect people around you is no different than needing to wear pants to protect people from seeing my micro dick. It's useful to me because it prevents me from being embarrassed, and it's useful to you because, well, you don't have to see my micropeen. But it can't be that simple to you. And I get it. I've been there. I know what it's like when everything cannot just be that simple. But maybe take a look at the sources I have in the description, and maybe take a little time to understand Occam's razor. The world's a complicated place, but there's no need to complicate it further with fantasy. That all said, if you guys enjoyed the video, please let me know. All the stuff that I used to make this video is in the description as usual. If you guys want to see more of my content, please hit the subscribe button, hit the notification bell, maybe support me on Patreon, that would be cool. The people you're seeing on screen right now actually do support me on Patreon, and they're all really awesome people. I honestly don't know what I did to deserve all of these people actually, like, supporting me. That's kind of neat. Oh, the credits that are rolling here in a sec are actually a little more accurate than they used to be, because I used to input all the credits manually, and that led to problems. I got messages every now and again about how there were inaccuracies there. That's actually fixed now, so that's good. Anywho, yeah, if you're a patron, you'll come up on these credits as well. It's $20 and higher patrons who actually get the slides. That all said, if you guys enjoyed the video, then please let me know in the comment section below, and as always, insert end of video tagline here.